Good morning, everybody. This is the Anchorage COVID-19 response operational update for September 9th. Roll call. Weather. Testing, vaccination.
Here.
Logistics.
We're here. Good morning.
Finance.
Good morning.
Safety.
Good morning, everyone.
Public information.
Good morning.
Liaison.
Good morning.
All right, Alaska's giving a sweepstake out there for $49,000 for those who are getting shots. Situation overview. Today is day 556 of the response. Locally, cases are up 1,396, 3 deaths, and 31 hospitalizations. Across the state, we're up 4,243 with 6 deaths and 92 hospitalizations. For 213 resource requests, we've filled or satisfied 1,802, filled 1 since last report, and currently working 23. For congregate shelters, we're at 345 with 1,035 meals per day. Non-congregates, we're up to 445, totaling all shelters to 790. For testing of vaccines, we have collected over the past week 7,243 samples. Cumulative vaccine distributions, we're up 54,381, totaling 90,856. Weather.
Good morning. This is weather. For the next 5 days, we're expecting mostly cloudy skies and light rain, at least through Monday, except for heavier rainfall between Sunday and Sunday night. There will be more sun breaks expected this Saturday with only very light rain over Anchorage. A broad front wrapped across the Gulf is responsible for the light rain late tonight through Friday. And for Sunday night rainfall episode, there's a developing front from the Northwest Pacific that will bring increased moisture and rain within that timeline into Monday. For this reason, we're monitoring the situation as it could potentially heighten winds in other parts of South Central and the Gulf, but not directly for Anchorage at this moment. Day temperatures will range in the mid-50s to lower 60s, with overnight low temperatures in the 40s. I appreciate your attention. Is there any questions?
Thank you, Weather. Testing vaccinations. Go ahead.
Good morning. This is Dana Loudy with the Emerging Infectious Diseases Program at the Anchorage Health Department. Cases in the community continue to increase. We are currently averaging 190 cases per day in the last 7 days. As of yesterday evening, our daily growth rate was 1.84%, meaning that cases are predicted to double every 37.6 days. The 14-day average reproductive rate is 1.074, so still above 1. The 7-day case rate is 508.7 per 100,000 population. Our current alert level is high, indicating that there's widespread community transmission and many undetected cases. The visit healthcare testing sites had a 3.5% decrease in average daily tests in the past week, comprised of a 3% decrease in the community drive-through locations and an 8% decrease at facilities for priority populations. The turnaround times for the visit healthcare tests are averaging 25 hours in the last 2 weeks. Approximately 9% of tests uni-wide were positive in the last 7 days. As a reminder, percent positivity above 3% indicates we are missing cases because the community may not be accessing available testing. In vaccinations, the visit healthcare vaccine clinics had a decrease in average daily vaccinations of 20% as compared to the previous week. Uni-wide, approximately 59% of residents over 12, including JBER numbers, are fully vaccinated. We have upcoming pop-up vaccine clinics today at the Alaska Literacy Program Health and Wellness Fair, the American Foundation for Suicide Prevention on Saturday, and the Spenard Rec Center on Tuesday. We are also continuing with our in-home vaccination program. Those appointments are available online or by calling 907-531-5100. Monoclonal antibodies, as a reminder, treatment with monoclonal antibodies may prevent high-risk COVID patients from progressing to more severe disease or hospitalization. The public should contact their healthcare provider to discuss getting a referral for monoclonal antibody infusion if they test positive. The public can also call the statewide COVID helpline to get more information about the treatment and to also locate the infusion sites. That number is 646-3322. You can also call that number for if they don't have a healthcare provider to refer them. The municipality currently has 2 large monoclonal antibody infusion facilities to the public and a mobile infusion unit as well. Pending any questions, that's in the report.
Dana, there is a question in the chat if there is an address for the suicide prevention clinic.
I can look that up and, PIO just posted it.
There we go.
At the softball complex.
Thank you very much, ma'am. Contracts logistics, go ahead.
Good morning, this is Wendy Reese, Contract and Logistics Lead reporting. We currently are starting the process of extensions for the mass care contracts through 12/31. We are continuing to support the family shelter options for increased needs as we see them. We're also supporting the testing and vaccine with optional drive-up sites and boosters. We're working to fill 2 EID personnel positions. The testing contract with Visit Health is extended through 10/31. We currently are working 22 resource requests that are ready for order status. We've filled 1 new personnel request since the last external operation update, and we have 7 personnel requests in support of EOC and AHD as a result of increased COVID cases. End of report.
Thank you, ma'am. Finance.
Good morning. This is Audrey Jo Malone reporting for Finance. Current encumbrances for the EOC spending is $21,025,588 with actual spent to date of $77,358,306 for a total of $98,383,894. Currently, we are seeking cost recovery for expenses by way of federal funding. To date, the municipality of Anchorage has received $14,931,723 in federal reimbursement. Please continue submitting invoices and supporting documentation to EOC invoices at anchorageak.gov. End of report.
All right, thank you, ma'am. Safety.
Good morning, everyone. This is Annalisa Roberts reporting on for safety. Having a post-COVID condition or supporting someone with a post-COVID condition can be challenging. When you're taking care of yourself and dealing with a long-term illness after having COVID, there's different ways to cope, but a good strategy, if possible, is to read about the experiences of other people with post-COVID conditions so that you don't feel alone with what you're experiencing, and also contribute to ongoing scientific research. When dealing with someone else and helping them recover, listen with compassion, see what you can do to help them. Don't offer unsolicited advice, and just let them talk to you however they need to. Start a conversation to gain understanding. What are you going through? How can I help? How are you doing these days? And then determining how you can help with what they need. If they say somebody to make them meals, someone to run errands, someone just to talk to, try to be that person for them. It can be exhausting, but we're all in this together. So try to do the best you can for yourself and for others around. Also, getting the vaccine is the best way to prevent transmitting COVID and getting really sick from it. So there's a lot of vaccine clinics out there. If you haven't already, please don't forget to get vaccinated and report.
Thank you, Safety. Public information.
Hi, everybody. So the public information team is working on a couple different things right now. Knowing that booster shots may be available in the next few weeks here, we are working on a survey to determine the type of vaccination sites that our community would like to see. Do they prefer walk-in sites or the drive-through sites? And also just trying to get a feel for how many people will be wanting that booster so that the vaccination teams can be best prepared to serve the community as efficiently as possible. Also looking into bringing back COVID radio. COVID radio was available for people last year who were waiting to get tested. And it'll just give facts and information about COVID-19, things like what to do after you're tested while you're waiting for the results, monoclonal antibody treatments, that type of information. So that is in the works also. And we are currently updating our communications plan to best reflect the current state of the response. Barring any questions, that is the end of my report.
Thank you, Buckle. Liaison, go ahead.
Good morning, this is Drea Welch, Acting Liaison Officer for the Anchorage EOC. Thanks to all of our partners who were able to join us today. Do we have any cooperators who would like to report out this morning?
Good morning, this is Jim Baldwin with the Food Bank of Alaska. We are currently not seeing an increased demand for food assistance at this time. However, the need is still high, but not as high as it was a year ago. Last year at this time, we were distributing about 800,000 pounds a month of food. Now we're doing about 550,000 pounds a month. So it seems like the food assistance need has leveled off, but we are continuing to watch and be ready to respond if there is an increased demand. I don't know if Jenny Ragland with Salvation Army is on or not. She might have additional information, but that's the end of my report. Thank you.
Thank you, Jim. Are there any other cooperators on that would like to speak?
Hi, this is Tracy with the JBER Emergency Operations Center. We're continuing to support JBER clinics and care providers with the 213RR process, and we'll be assisting public health with a vaccine clinic in Houston tomorrow at Station 9-1. End of report.
Thank you, Tracy. Is there anyone else? And we did get a report from the Salvation Army last week, and I can just kind of read that. I had put it in the chat, but in case people don't have access to the chat, Jenny, you stated that all of the Salvation Army's Anchorage-based programs are operating with modified safety protocols and enhanced sanitation measures to help mitigate COVID spread. The Older Alaskans program is continuing to serve seniors through home-delivered meals and has resumed congregate feeding programs. Serendipity Adult Day Services has reopened for in-person programs at the end of July at 50% capacity with up to 20 a day. Program hours are reduced to limit the in-person contact to half a day. At McKinnell House, they're currently serving families experiencing homelessness, and it is at capacity of 16 families. We are able to isolate any household that tests COVID positive, and they currently did have one COVID case. At Clitheroe Center, they have biweekly testing in place, and there are currently no COVID positive cases. They are operating Kings Lake Camp Summer Camp with reduced capacity at 50 campers per week, and the Anchorage Core Community Center after school program is open and providing childcare services. And again, that's the report for the Salvation Army that she had given me last week. All right, next slide, please.
Ma'am, we do have Ron Schwartz.
Oh, sorry. Okay, go ahead, Ron.
Yeah, from UAA OEM, I'm just reporting that we have 90% of our resident students are vaccinated, 10% have exemptions. We have a mask mandate policy in place for all inside spaces and even outdoors when you can't maintain 6 feet of distance from others. Our buildings remain locked, so our stakeholders that are either students or employees have proximity cards to access each building. And we are maintaining a 5-person safety staff to do contact tracing and support. And we're using the 14-day quarantine period that many were using last year. End of report.
Thank you for that, Ron. And I believe I have the state of Alaska on as well to give an update on their operational period or situation.
Good morning. This is Gene Wiseman with the state of Alaska. Thanks for the opportunity to join you this morning. So currently we are stand up in a singular command at the housed in Department of Health and Social Services, working with our hospital partners on trying to build staffing capacity for them through a GSA contracting source. And hopefully will yield some relief there. We will know more next week, but we're requesting near 500 medical personnel through that process to help with that. Let's see, I got a list of questions here that you guys have asked. There was a question that was asked about DoD or National Guard deployment, and currently that is not an option for medical support at this time. And that's, I believe I hit all the questions that were asked on the email. Thank you.
Thank you for that update, Gene. Are there any other cooperators on the line that would like to provide an update?
Hey, this is Don Carden with U.S. Army Alaska. Just to let you know, both at here at Joint Base Elmendorf Richardson and at Fort Wainwright, we have plenty of vaccines on hand. We are trying to get all the soldiers and airmen vaccinated no later than the 17th, except for those who are refusing the vaccine. And then we expect the President to make some type of announcement today, President of the United States to make some type of announcement today. Over. So I don't think we would require anything from the state. Over.
Thank you for that update, Don. And if we can flip to the next slide, I do have the vaccination numbers up for JBER. So currently they have 4,457 soldiers assigned. 139 of those were vaccinated on 8 September of 21, and that includes 57 off-post vaccination cards that were turned in. They currently have 3,209 fully vaccinated as a running total, which is approximately 72% of their soldiers assigned. This includes 34 fully vaccinated cards that were turned in and 11 second doses. They have currently 25 declined for a religious exemption, 18 declined for a medical exemption, and 59 have declined for other reasons or a direct refusal. So currently they have 1,248 remaining soldiers for the Army that have not been fully vaccinated, with that breaking down into 580 have had their first dose and 668 have not started the series. Are there any other updates for JBER reflecting the Air Force side?
No, ma'am. I sent you the Colonel Finney, Lieutenant Colonel Finney, and Tech Sergeant Nuno's email They would have the whole entire picture at the 673rd Med Group.
Thank you for that. I will follow up by email with them, and then we will get those posted on the slide. All right, next slide, please. We'll get started with the hospitals. Is anyone on from A&MC?
Good morning. Hi, this is Lori Olson. We currently have 38 COVID positive inpatients, 8 in the ICU, 7 are on vents, 1 is on BiPAP. We are still experiencing staffing issues. It's been exacerbated by classroom closures, both in school districts, MATSU included, as well as some of the daycare facilities. End of report.
Thank you for that. Is anyone on from Alaska Regional?
Good morning. Can you hear me okay?
I can. Go ahead, John.
Excellent. Currently, Alaska Regional Hospital has 37 COVID positive patients, 7 in the ICU, 6 on vents. We too are tight with staffing, tight with space, and we are pretty much evaluating every service line and every variable, including staffing options, to keep it going. End of my report.
Thank you for that report. And is Providence on?
Good morning. This is Nikki Holmes from PAMC. Today we have 46 COVID positive patients, 8 in the ICU, 5 on mechanical ventilation, and 28 COVID recovered. We are still dealing with staffing and capacity issues. Staffing has been a big concern. Still have the incident command post open, and we did further restrict visitation as well since last week. Thank you.
Thank you for that update. And is anyone on from Matsu, Kara?
Good morning, Kara Cahill, Matsu Regional Medical Center. Kind of echoing the other 3 facilities with staffing issues. We are triaging and postponing elective procedures based on different units and their patient needs. And we are sitting at 38 positives with 14 in the ICU and 10 on vents, no PUIs at this time. End of report.
Thank you for that. And that's the info liaison.
All right, thank you, ma'am. As a reminder, our next operational update brief will be next Thursday, the 16th of September at 10 a.m. Thank you all for coming and have a great day.
Can I ask a question, please?
Go ahead.
Hi, this is Jocelyn from the Hospitalist Group. Can the hospitals share the percentage of ER visits that are COVID related, or potentially some status of the ER holds as well on these updates?
Yes,
I'd be happy to do it. I don't have that information at this time.
Okay, yeah, maybe starting next week. I think that'd be helpful information if that's not too onerous. Thank you.
This is Nikki from PAMC. I can check in and see if we can get that information out today and then for next week as well.
Jocelyn, this is Bonnie Bailey with the state of Alaska. They are sharing ED holds on the morning briefing with statewide hospitals. So I do think that is being consistently shared. So maybe we can follow up about that so I can get that to you.
Great. Thanks, Bonnie.
All right, Wendy Williams, you have your hand up. Please go ahead.
Hi, this is Wendy with the Anchorage Health Department COVID response team. I just wanted to see if we could get an update on the status of our EOC Q&I housing in the municipality. We're getting reports regularly that they're pretty near capacity, and we are also seeing a significant increase in the number of positive tests returning on admit for those housed or close contact quarantine. Are we looking currently at alternative housing options if we were to see any further spike in that, or if it were to happen after hours or on a weekend?
Okay, so we believe, Wendy, if Mass Care, I'll give them a chance to speak first. Is Sean available? Okay, so I can say that at this time we believe we're within capacity. We are monitoring that closely, and we have been for the last couple weeks, but we will get with you, Wendy, offline as we further evaluate it and speak with Sean on the matter.
Great, thank you very much.
Ms. Olson, you have a question?
Hi, yes, I was wondering if I could get somebody from the Anchorage Health Department to contact me regarding the child care closures and the processes and procedures. We just need to understand a little bit more about close contact closures and closures related to siblings.
Yeah, Laura, I can connect with you here after this. If you want to, I can put my email address in the chat and my contact number. We can connect.
Thank you.
Okay, so Ms. Wendy Williams will be contacting you. Are there any more questions? All right, everybody have a great day. Thank you.